The tricky part about having pain during pregnancy is that a few things. One is you can't take any pain medications. Obviously, another thing is you're going through a lot of different body changes and weight gains, and there's going to be pelvic changes that happen. The body actually releases a hormone called relaxin, so all the ligaments in your spine and pelvis are going to relax for obviously to prepare you for childbirth. And so all of those changes happen, and you're starting to walk, and you're carrying a little extra weight, and it puts a lot more stress on things like the low back and the hips, even the neck area, mid-back. And so we see that happen quite a bit. And then from another tricky standpoint is we can't even do some of the conservative treatments we would like to do with you because of the pregnancy. And so there's always a lot that we have to assess and figure out what's going on and then deliver the right types of treatment methods for you. Because the reality is through those biomechanical changes that happen, and then giving birth, you're going to lose a lot of core stability. A lot of the biomechanics are going to be altered, and then you're going to have a baby that you're going to have to pick up. The baby's going to get bigger. If you do breastfeed, then that's going to be holding a baby. Even if you're not breastfeeding, you're going to be holding the baby a lot, and that kind of gets you into more of a slumped posture. And so not only are you dealing with body changes, you're also now going to be picking up a child a lot, and again, that child's just going to continue to get bigger. So what we've worked on a lot in our clinical setting is to take the pregnancy, hopefully early on, and we really start working on a lot of core stability exercises, specific ones that we can do as the trimesters go along, and be able to do them, and they're very effective and they're safe and they're comfortable, so it's very helpful. The second thing that we typically do obviously is a light chiropractic manipulation in the pelvis or mid-back if needed, if that's indicated. Not all of our pregnant patients do get that, but that's definitely a great option. And then finally, we do a lot of muscle work. There's a lot of muscle reactions going on to the different changes going on in the pelvis and in the body in general, and so we do something called active release technique, which is a muscle therapy to try to keep those muscles normalized in a sense. And so really trying to get the mother-to-be to, one, understand what's going on, and then give them some solutions that they can do during their pregnancy, and then follow up with those after the pregnancy once everything's kind of settled down, and from there have a game plan to prevent the common back pain that happens with women during pregnancy and even into postpartum. And so it's not just usually a 9-month thing for this pain issue that we're seeing, it can extend longer. And so we want to get to it early and give them a really good, concise plan, treatment, and at-home care to prevent this from becoming a long-standing issue. So we see a lot of pregnancy in our practice, and we definitely try to give a good plan for that mother-to-be.